legal experiences, business experiences, healthcare experiences. I've seen over the last 25 years people getting into this field from a very diverse sort of background. And so I think it starts with having a love for making a difference in people's lives. It starts with that. And if that's at your core, then the business side of healthcare really is about putting people in the best position to take care of others. So my job ultimately is to be the servant of all of the folks around me, the clinicians, the physicians, the folks that keep the building clean, that feed our patients and our staff. My job is to put them in the best position to be successful. And so I actually think people that come from a wide variety of backgrounds can get interested in healthcare. I think one of the interesting things and unique things about running a rural hospital is you tend to have to be a little more of a generalist. You need to have a broad base of perspective and experiences to do well in a rural environment. In a more urban environment, you tend to have a lot more people to help segregate the work. So in my case, although I've got a fantastic group of vice presidents that help support the activity, as the CEO, I don't have a strategic planner in my organization. I don't have somebody whose sole responsibility is focusing on planning, just as an example. So I need to be able to do that as well as do the day-to-day leadership and think about maintaining the relationships with our medical staff and working with our board of directors. And so I think the reality is in a rural community you simply have less resources, and so you need to have a broader perspective when you look at your leadership role. Technology is making a huge impact on the delivery of care in rural environments across the country. So it starts right with the clinical side of things, things like our electronic health record, right through to our EICU. We're connected to a large tertiary center so that critical patients being cared for in our institution can be done so during the day with our critical care physicians. But at night, they need to go home and get a good night's sleep so they can come back and start all over the next day. So we're connected to a large tertiary center and have intensivists on call 24/7 for us, but in particularly take primary care of the physicians at night. The picture archiving systems, probably the digitalization of radiology and images, I think is probably the biggest technological change I've seen since I've been in the field for 25 years. And our ability to really bring specialists and specialty care to our medical centers is really valuable. So that's kind of on the clinical side. On the more administrative side, I think the big changes has been the ability to do webinars and stay up to date in terms of educational opportunities and not have to travel as much to keep up to date. Certainly interacting with colleagues through digital conferencing and video conferencing is making a big difference. And I think the way you keep up on that is just exactly by using the technology. So by having access to up-to-date educational programming on what's new and some of the latest technology out there for supporting both the clinical and the administrative side of healthcare. You look at things that are happening today with healthcare delivery reform, there's a lot of things up in the air. In some respects, things are moving really quickly. In other perspectives, we're kind of frozen in terms of planning for the future. What's the Supreme Court going to do on its ruling in terms of the individual mandate, for example, on the health exchanges, and what's going to happen with some of the reimbursement rates that are in play with healthcare reform, and what's going to happen with the changes that are taking place in terms of the responsibility that patients are starting to have for more of the healthcare costs with higher deductibles and co-payments. All these things are creating a real dynamic change. And I think that's both creates all sorts of opportunity, but it also creates a lot of uncertainty. And so trying to plan for that means spending a lot more time keeping up with what's going on, whether that's journals both inside and outside of the field, whether that's participating in all the educational opportunities that are available online, or going to conferences, working with the American College of Healthcare Executives or the American Hospital Association or state hospital associations to go to their offerings to keep up with all the things that are taking place today. Well, I'm particularly interested in the dynamically changing environment because I think for the first time in a long time, where we're headed with population health is really beginning to connect the dots a lot better in terms of what our true mission is with how we get paid. So right now, we get paid based on volume. So although my mission statement says to improve the health of my community, boy, I sure hope they use the heck out of my CT scanner when they're doing that. Now, where we're going with population health and really truly being incented to provide efficient care, high quality care, care that does create an opportunity for people to be healthier, and being incented to do that actually lines up our mission much better with where things are going. So that's the part of healthcare reform and where things are going. And I guess my hope is we move as quickly as possible to that point where making a difference in people's lives is how we actually get reimbursed.